Welcome everybody. I'm so delighted to introduce you today to the Chief Executive Officer interview on AMR with Professor Sabiha Essack. It's so important that in pharmacy we play our part to tackle and lead the global challenge that AMR faces us with. And COVID-19 has really brought that to light even more in sharp focus. Today we have an opportunity to discuss an important issue like this and how we plan to address AMR through stewardship, aligned activities, and most importantly, partnership across all our countries and our organisations so that the profession can really step up and step into the place. Before I introduce you, Sabiha, I just wanted to say a little bit about you. You are a professor at the University of KwaZulu-Natal in South Africa. You are the South African Research Chair in Antibiotic Resistance and One Health, and a Professor in Pharmaceutical Sciences, a Director of the Antimicrobial Research Unit, and General Secretary of the Academy of Science of South Africa. You are the South African Research Chair in Antibiotic Resistance and One Health, and Professor in Pharmaceutical Sciences, as I've mentioned. And in this role, you are the Senior Implementation Research Advisor to the International Centre for AMR Solutions. You serve as an expert consultant on AMR and AMS to the World Health Organization. You are the chairperson of the Global Respiratory Infection Partnership, called GRIP, and you serve on the advisory board of the Combating Antibiotic-Resistant Bacteria Biopharmaceutical Accelerator, the Fleming Fund Expert Advisory Group, the Market Analysis Expert Advisory Group of the Global AMR Research and Development Hub, and you are a member of the Wellcome Trust Surveillance and Epidemiology of Drug-Resistant Infections Consortium. So I do believe, Sabiha, without further ado, you are eminently qualified to chat with me today about some of the challenges we face, but also some of the solutions we can embed. Welcome, Sabiha.
Thank you very much, Catherine. It is an honor to be included in the FIPP CEO interview series. Thank you for inviting me to participate.
You're super welcome, Sabiha. Without further ado, we have a lot to cover, and I know you and I can actually get very passionate about this area. So I wanted to start at the beginning. AMR, antimicrobial resistance, is a growing concern for us all. Can you walk us through the situation globally and give us a bit of perspective?
So antimicrobial resistance is the silent pandemic with severe consequences on the health, welfare, and well-being of humans, animals, plants, and the environment. AMR is a One Health issue with severe health, economic, and societal implications. Just for a few indicators, the O'Neill and World Bank reports forecast greater than 10 million deaths attributable to antimicrobial resistance, 28 million people living in poverty, a 7.5% decline in global livestock production, and a cost of $1 trillion in additional healthcare costs by 2050 should urgent action not be taken now. Catherine, the COVID-19 pandemic will worsen every single one of these indicators. At the coalface where we as pharmacists work, infections caused by drug-resistant microorganisms result in treatment failure, longer durations of illness, and the subsequent increase in risk of spread in communities. Higher mortality rates and increased costs of alternative treatment are also associated with antimicrobial resistance.
As you say, Sabiha, every one of those indicators, which were sobering enough, are worsened by the pandemic we find ourselves in. Can you give me a little bit of an overview of the direct impact of COVID-19 on AMR?
So COVID-19 has compounded antimicrobial resistance by increasing the selection pressure of extensive and unfortunately inappropriate antimicrobial and biocide use. We know that antimicrobial resistance is a function of time and use. The greater the quantities of antimicrobials used and the longer the period for which they are used, the greater the selection pressure for resistance. Now, despite the lack of evidence to support the use, antiretrovirals, antimalarials, and antibiotics are currently being used in the management of COVID-19. This is escalating antimicrobial resistance. If you add to this the extensive use of biocides to curb spread, we have additional selection pressure, as biocides contained in hand sanitizers and household disinfectants have been reported to co-select for antibiotic resistance.
What we're really seeing is that we're exacerbating the resistance issue in trying to manage some of the impacts of the pandemic itself, which of course in the short term may not have a huge impact, but we also know that AMR has been escalating in recent years. So this is a very sobering fact for us, isn't it, Sabiha?
Absolutely. It is an extremely sobering fact. And to confound it even further, while antimicrobial resistance was very high on the global political agenda and one of the highest public health priorities of the World Health Organization, it has been superseded by COVID-19. And AMR surveillance is being deprioritized. AMR antimicrobial stewardship has been deprioritized, and this is just escalating antimicrobial resistance.
Yes. We find this a lot in the issues with our profession, Sabiha, things like drug shortages, supply chain issues, AMR, many of the prevention agenda items, they've all been exacerbated but deprioritized during COVID. Sabiha, we know that each of the health professions and every health worker has a role in AMR. What do you believe pharmacy has a role to play in fighting AMR?
With absolutely no bias, I'd like to say that pharmacists have a leadership role to play in preventing, containing, and mitigating antimicrobial resistance at policy and practice levels. We've already started playing a leadership role via FIP. The 2017 FIP policy statement on antimicrobial resistance describes the roles of the community, hospital, industry, and regulatory pharmacists in the context of the Global Action Plan on Antimicrobial Resistance. Prior to this, FIP published the contribution of pharmacists in fighting antimicrobial resistance. And this describes the pharmacist's role in appropriate antimicrobial use, stewardship, optimal treatment management, antibiotic quality, safety and efficacy, health promotion, infection prevention, and triage that weighs pharmacist-determined symptomatic treatment with referral to a doctor. And if you look at that publication, there are so many ways in which pharmacists can play a really impactful role in mitigating antimicrobial resistance. Catherine, being the chairperson of the Global Respiratory Infection Partnership, I would be remiss if I didn't bring up our 5P pentagonal framework, in which the pharmacist plays a key role in the prevention of antimicrobial resistance. So our 5Ps are policy, patients, prescribers, pharmacists, and prevention. So pharmacists' impact on prescribing practice, on patient behavior, and policy implementation for the prevention of antimicrobial resistance. So our framework really advances antibiotic stewardship in acute upper respiratory tract infections, which are particularly important today as the vast majority of COVID-19 cases are upper respiratory tract infections that are non-severe and managed at community level. And I think I'm going to put in here a little blurb for our workshop on the 12th. I want you to encourage you to watch a webinar on the leadership role of the pharmacists in implementing the Global Action Plan on Antibiotic Resistance in a COVID-19 world. This is in preparation of the upcoming FIP Global Workshop on Driving AMR in a New Decade on September 12th and is available on the FIP website.
I think that's a great plug, Sabiha. I have to say, I'm going to come back throughout the rest of the interview and ask how we can work together to amplify opportunities to get involved across all of our profession. And I think what's really, really important is that we work in partnership, pull together the groups that you're involved in and other colleagues are involved in, and create a leadership opportunity for FIP. Not for FIP to do the work, but really for FIP to coordinate and allow the experts and allow all of our practitioners to play their part. So it's really up to all of us to work together, isn't it, Sabiha?
Absolutely, Catherine. This AMR requires multi-stakeholder, multidisciplinary, multi-ministry working together to mitigate antimicrobial resistance. It's not up to a single health professional or veterinary professional, but it requires us all to work together and mobilize towards the common good of sustainable antimicrobials for the future.
That's such a great message, Sabiha. I have to say, during the COVID pandemic, what FIP has been humbled to see is the leadership on the ground by our profession. And it's for organisations like FIP and the ones you work with to really showcase and amplify that work. So, Sabiha, let's move along then. What role, you mentioned you have the 5P pentagonal framework, and I really like that because that's very practical, and it also pulls together the 5 key areas to advance antibiotic stewardship in upper respiratory tract infections, which of course is impactful today, as many of the COVID cases are non-severe, we know that. But actually we could apply that to all of our work in collaboration. But I just mentioned there that we've been humbled and inspired by many of the opportunities that community pharmacists particularly have played in COVID, alongside hospital, academic, industrial, and our emergency care pharmacists. But what role can community pharmacists play specifically, Sabiha, in the work that you've outlined?
Sure. So I want to focus on their role in terms of their interactions and communications with both prescribers as well as patients. So the first role would be to liaise and consult with prescribers on antibiotic prescriptions. This is to promote appropriate prescribing, adherence to guidelines, and optimal treatment regimens. The correct, the 4 R's, the right drug at the right dose for the right duration for the right patient. The second really deals with supporting, advising, and educating patients. Remember, the pharmacist, especially the community pharmacist, is often the first link with the healthcare system. And we really are very ideally placed to educate and support our clients and our patients. So some of the things that we can speak about would be common ailments, their causes, symptoms, and likely duration. When do patients need to see a doctor? We have, by virtue of our extensive education, the ability to assess for severity of illness and the identification of any red flags or risk factors for serious infections, things that we can't manage at a community pharmacy level, but which would require the input of a medical doctor. We know everything about symptomatic treatment options for self-limiting illnesses, such as non-severe COVID-19 and other upper respiratory tract infections. We play a role in infection prevention and control by promoting vaccination campaigns and simple hygiene measures, which are so important when it comes to curbing the spread of COVID-19. We are able to educate on how infections occur and are transmitted, and when antibiotics are warranted, we are able to speak about what they're effective for, how antibiotic resistance can occur, and why it is so important. So a little bit more about when antibiotics are warranted and prescribed. We need to ensure that we advise the patients on compliance, that is the importance of taking the antibiotic as prescribed, following the correct dosage regimen, potential adverse effects and what to do if they occur, and any risks of interactions, especially where patients are on chronic medication. We also have a role to play in the disposal of old and unused antibiotics, although I hope that that doesn't happen because everybody should actually complete the course and take the antibiotics as advised. And then finally, we have health education and promotion campaigns related to antimicrobial resistance. So the community pharmacist is either the first or the last point of contact with the healthcare system, and we are really so well placed to inform and advise and educate both the patients as well as the prescribers.
That's really great, super clear, Sabiha, and also just a real acknowledgement that whilst we hope that old antibiotics aren't being used, we know that the community pharmacists are ideally placed to manage such usage and educate and inform. And I think that's really, really important. I also really like the idea that pharmacists are frontline in managing mild diseases, because we've seen that works throughout COVID. And indeed, that's part of the imperative that FIP put forward at the sign up to the Astana Declaration in 2018. We cannot have primary healthcare globally without pharmacy playing its full role. And that starts in the community. But without further ado then, I mentioned earlier on that all of our profession across all sectors have really played a role in COVID. And that has been clearly articulated when we've seen examples What would you say, Sabiha, is the role of the hospital pharmacist in fighting AMR?
So the hospital pharmacist is an integral member of the antimicrobial stewardship team and program because they have the greatest drug expertise. And this is especially important during the COVID-19 pandemic, where there are so many reports of widespread and inappropriate antimicrobial use and antibiotic use in hospital settings. So key stewardship interventions at the hospital level involve, firstly, prospective audit with direct intervention and feedback. Here, pharmacists participate in ward rounds as part of the stewardship team to review and advise on antibiotic prescriptions. Are they needed? Are we using the narrowest spectrum? Is this the correct dose? Are we dosing it at the correct dosage, correct frequency or dosage intervals? And are we monitoring to see whether this is actually warranted, or when we can stop we can stop the therapy. Another intervention involves evidence-based guidelines and clinical pathways, where pharmacists ensure the implementation of treatment guidelines for infections based on hospital antibiograms and hospital formularies. So the type of causative bacteria or other microorganisms that cause infections in hospitals would differ, and they would have different susceptibility profiles to different antimicrobials. So the pharmacist really knows what these antibiograms are and can advise the best treatment option in that particular ward or for that particular patient. And then pharmacists are also very well placed to advise on combination therapy, de-escalation, dose optimization in special patient populations, and converting from parenteral to oral dosage forms.
Yeah, really super overview there, Sabiha. And I also think that key part of the communication between the sectors for our profession, this is a passion of mine since my PhD way back last century, really, you know, that whole idea about moving a patient from parenteral to oral medicines, but then also managing that oral therapy when they get home is super important. You've mentioned the prescribing elements and obviously the patient-facing ones of both hospital and community pharmacists. Are there any other aspects pharmacists should become involved in? When I look at your Pentagon, you also mentioned policy. How can pharmacists get involved in that?
So on national and policy levels, pharmacists can play a very important role in drug regulatory bodies to ensure the safety, efficacy, and quality of medicines. This really becomes very important in low and middle income countries where registration is more dossier and paper-based as opposed to lab-based where products are actually tested. So this is really important for us to take part in the regulation and the registration of medication. The second is to optimize supply chain management. With the travel restrictions and border closures, it has really hit us hard in terms of our supply chain. And many countries do not have access to vital drugs, including antimicrobials. And this has really opened up the market for substandard and falsified drugs. So we really have to make sure that we play a very vigilant role in identifying and preventing the proliferation of substandard and falsified drugs. And finally, it's for us to ensure that the AWARE categorization is implemented in our country essential medicines list. Now, Catherine, you're aware that the WHO revised its essential medicines list recently and introduced, in terms of antimicrobial resistance and antimicrobial stewardship, an AWARE categorization. And if you'll just indulge me a little bit, I want to speak about that a bit more. So the A for AWARE stands for access group of antibiotics, and this consists of antibiotics with which are active against a wide range of common susceptible pathogens with lower resistance potential. And these are the first line essential antibiotics that should be widely available, affordable, and quality assured. Catherine, 30% of the substandard and falsified drugs reported to WHO belong to the access group of antibiotics. So it's so important for pharmacists to really speak to mitigating falsified antibiotics. Very quickly, the watch group of antibiotics have higher resistance potential, and these include the highest priority antibiotics that are critically important for human medicine. So they're critically important, and resistance occurs to them relatively easily. So we have to watch them. And then finally, the reserved group of antibiotics, these are the broad spectrum antibiotics that should only be reserved for use in difficult to treat infections or infections caused by multi-drug resistant organisms. And these are the last resort options. So it's really important for us to ensure access antibiotics are always available. We're watching to see whether resistance is emerging to the watch group, and we're really making sure to reserve the reserve group of antibiotics for patients who really need them.
So Sabiha, I mentioned to you what was really, really humbling and inspiring during this COVID pandemic was to see how pharmacists could step up and step into the space of patient care and ensure safe access and safe supply of medicines and be the port of call in every single community. And we know that for colleagues to really get engaged, they need to be able to advocate for the areas. So when you are thinking through the AMR agenda and how pharmacy can step up and step into the space around managing AMR, what would be your tips, Sabiha, for listeners who want to become AMR advocates?
So firstly, ensure that you have the most up-to-date knowledge related to antimicrobial resistance. So you speak from an evidence-based perspective. There are so many MOOCs, massive online open courses on AMR. I subscribe to feeds like the CDEP and the CIDRAP weekly digest, the REACT and the AMR Insights newsletters, WHO virtual communities of practice, to name a few. And it's just assimilating all of the work that is being done on AMR and really speaking from a point of knowledge and confidence in the knowledge. So that's the first one. Know what you're talking about. The second bit is learn appropriate communication skills so that you can interact equally well with policymakers, other health professionals, patient advocacy groups, patient safety groups, and civil society. And the important thing to remember is that the health literacy levels will differ. So where you may be able to speak on a very scientific level with other healthcare professionals or academics, you would really have to be able to speak to the lay person as well on antimicrobial resistance and how this occurs. I would suggest that you join professional networks, associations, communities of practice working in AMR to learn, but also to contribute. Communicate and collaborate with key opinion leaders. These people welcome the opportunity to mentor emerging AMR advocates. Identify strategic opportunities to increase your visibility. Use networking opportunities at events, conferences. Put yourself out there to be seen and be heard.
Great advice, Sabiha. I also think it's really important that the profession has access to things other than pharmacy related to get the different perspectives, as you mentioned. So that's really handy. I bet everybody's going to be pausing the interview here and taking notes. But Sabiha, some people may find it difficult to put themselves forward when they don't identify themselves as an expert yet. You are one of the leading experts in AMR at FIP, but indeed globally. For example, you contributed to the policy statement of FIP on AMR. What do you think are the future plans of FIP to reduce and minimize AMR?
It was an honor and a privilege to work on the FIP policy statement on AMR. Together with colleagues, I am currently working with FIP to establish the FIP AMR Commission. This commission will adopt an inclusive approach to antimicrobials. So we're going to cover antivirals, antifungals, antibacterials, antiparasitics, biocides, disinfectants, and the commission will identify key work streams across research, pharmacy practice at community and hospital level, and education to map existing AMR-specific and AMR-sensitive activities. We're going to identify and address gaps. When we speak about AMR-sensitive activities, so these don't directly speak to AMR, but investing in them or forefronting them will help curb AMR. So for example, FIP has a very good toolkit on the pharmacists in vaccination. If we vaccinate patients or our clients, they don't get infections. They don't require antimicrobials, and therefore they decrease the selection pressure for antimicrobial resistance. Other work of the Commission will be to define a pharmacy-relevant research agenda to mitigate AMR, to map and develop education and training courses and resources across the pharmacy personnel, and especially on antimicrobial stewardship, and then develop advocacy, policy, and practice toolkits to optimize antimicrobial use, advance antimicrobial stewardship, and prevent and contain AMR. So Catherine, in essence, the Commission will be responsible for implementing the FIP policy statement with support from the FIP member organizations. In doing this, we will ensure as the Commission the relevance and adaptability of all activities and interventions in all income settings, but a particular focus on low and middle income countries. I believe that the Commission will be launched on the 24th of September after the announcement of the FIP development goals, one of which focuses on AMR. And I hand over to you, Catherine, to tell us a little bit more about that.
Yeah, I think this is super exciting. I think the fact that we're creating a commission that is overarching, not just focused on practice, but also focused on research agenda, the idea that it's thinking about education and training courses, or just even, updating people. But these advocacy, policy and practice toolkits are really super practical ways in which we can work together to mitigate AMR. And I agree with you completely, Sabiha. This is an overarching area. Prevention of all of our diseases means prevention of the use of antimicrobials and wider. So I'm really excited about this. Yes, we're going to be launching the FIPP development goals on Monday, the 21st of September. And that starts World Pharmacy Week, which culminates in the 10th World Pharmacist Day on September the 25th. But one of those goals will be antimicrobial resistance, antimicrobial stewardship, and indeed managing those conditions that require antimicrobials as well as vector-borne diseases is really important. So September the 24th will be the launch of the Commission, and welcoming those to get engaged and involved as an expert or as an advocate. And I think, Sabiha, having different ways in which our profession can engage with such a commission or the work of such a commission will be really important. That brings me on to our next question, which is, can you give us an idea of the deliverables of the AMR Commission so people can get excited and enthused about being part of it, whether they're an expert or not?
The FIPP AMR Commission is going to develop the how-to guide. So it'll develop the FIPP AMR policy implementation plan. We've got the policy, and how do we put this into practice? We're also going to develop the AMR research agenda, contribute to AMR toolkits and resources for the pharmacy workshop in totality, in addition to creating a database of existing education and training courses and materials. Our very first output, and we're really excited about this, will be the regional and global roadmaps for driving AMR in the next decade, which will be developed by way of workshops during the virtual FIP conference on 12th September, followed by regional workshops on September 16th and 17th. We need your voices in developing the regional pharmacy-specific roadmaps and action plans to mitigate AMR, and I strongly encourage all of you to register for the workshops on the FIP website. I look forward to participating with you at these workshops.
That's a really important point there, Sabiha, isn't there? That we will have the virtual events happening on the 12th, and that will be workshops, and then regionally applicable later during the virtual programme, culminating in the launch of this commission on the 24th of September. So we would encourage all colleagues to engage on the 12th, listen and feedback, and then again engage more regionally so that we can build the roadmap for your region, wherever your member organisation or your country is based. And then you can push for us to prioritise through the launch of the commission on the 24th of September. Having a way in which all of our profession can engage and be involved in this absolutely massive agenda, I think will be empowering and will be a huge opportunity for pharmacists to realise their full potential in AMR. Sometimes, Sabiha, when you look at a challenge like AMR and you're in the middle of a global pandemic, and we have challenges like climate change to face and we have all the economic outfall of the pandemic, I think it can be sometimes a bit overwhelming for our profession to know exactly how they can contribute in a meaningful way. So I commit to you and to the Commission and that FIP will provide practical, suitable and applicable ways that everybody can play their part in AMR. And once we have that through the Commission, then I think we can see the evidence of impact and that the members of our profession can tell us what they need to be able to have that impact. Sabiha, I'm so delighted to have spent some time with you today. Thank you so much for your hard work in the profession and outside of the profession in this area. You are a true inspiration to us. And as I say, I can't wait. I simply cannot wait to be part of the events on the 12th, the 16th and the 17th, culminating in the launch of the Commission, with lots of hard work ahead for the rest of this year and into 2021 and beyond. Sabiha, any final remarks?
So first of all, to thank you very much for this opportunity, Catherine. But just to end off by saying that we as pharmacists have immense capacity to contribute to the stewardship and conservation of our dwindling antimicrobial resources. And we should actively mobilize in our individual capacities, but also as members of organizations such as FIP, both locally and globally, to really mobilize and entrench our leadership role in the prevention and containment of AMR. And I commit to you, Catherine, that I will work with FIP to realize our vision as an AMR Commission. So thank you very much for the opportunity. And I look forward to participating and contributing to the workshops on the 12th, 16th and 17th.
It's going to be great working with you, Sabiha. We're building on the strengths of what's happened before, and together with our profession, we can make the difference we need for AMR. Thank you so much, Sabiha. Thank you for your time, and I'll see you very soon. Take care, safe, and be well.
Thank you. You too. Bye.